Meeting of the COVID-19 Task Force. Oh, hello, Alice. Thank you for getting on here. Our theme for this week, or for this meeting, will be a review of what transpired over the holiday weekend. Toward that end, during Matt's time, we have some additions to the agenda, which I just want to make you aware of. We're going to divide Matt's time up into 3 speakers, actually. So Matt, Pat Finnegan will be invited on for her perspective, and then we have Scott. So everyone say hello to Scott up there. He's up in my left corner. He'll share his perspective on what he saw in the field. There are no minutes, so we can use that time then. So Matt. We will have Eric Fogg, I believe. Matt, I think he's going to be on, and I hope Charlie gets on here in a moment. But Matt, you want to kick off the update from the field, please?
Sure. I have maybe a couple of different things this week. I'll give you an update on what's transpired over the last week and the holiday weekend, and then I have a thought this might be a good time to summarize the response and actions of the police department and the town perspective to date. I will tell you that this past weekend, since we last met, the police department has responded to 422 calls for service over the last week. We have been very busy with non-COVID related calls for service. So normal police operations for us has ramped up significantly, particularly over the holiday weekend. We had 5 officers working at a time, and for a period on Saturday, that wasn't quite enough even. We were incredibly busy, and I would say, again, this isn't COVID related, but one of our busiest shifts that I can ever remember happened on Saturday night into Sunday. As far as the holiday weekend is concerned, the weather right on the coast wasn't necessarily fantastic. Just a little bit inland it was. But we had some fog and some cooler temperatures along the coast. Thursday, though, at the beach was hot, and it was busy. The beach looked like a normal day in July. There were the parking lots were full. The beach was busy, and it was hot. So it was busy. We did again see the similar kind of themes where there was some social distancing issues on the entrance and exits to the beach. The beach bridge on Beach Street has been, I would say, busier than I remember with people fishing, but it's also been pretty busy with pedestrians. As you guys discussed in earlier meetings, they do a pretty good job of flowing one way on the way in and flowing one way on the way out. But people have masks, but they're definitely taking them off once they're in their family groups or their travel groups on the sand. Again, I think taking a sort of the best bird's eye view we could from the marginal way looking down on the beach, it looked like people were doing a decent job of spreading out more than we generally had seen in years past, where it wasn't so crowded at the entrances, and it looked like people were spreading out. As far as the marginal way, we've continued to have at least one community service officer stationed on the marginal way, and he or she has been giving out masks to those who don't have them. And we are averaging 40 to 60 masks given out per day has been the average. And my personal observation has been that the mask compliance on the marginal way has gone way up since we started having a CSO permanently or stationed there. during the day. So that's sort of my summary of the week that has just passed. And then if you guys are okay, or Bob, you're okay, I just kind of wanted to jump into a to-date summary, if that's all right with you.
Great. Yes, please.
So I just kind of thought this might be a good time in our response, where we're in sort of the thick of summer, and we've come from a time when this started and we were still dealing with snowstorms and things like that all the way to the middle of summer. I just wanted to summarize sort of some of the things that we're doing and a little bit of our staffing. So most of you know, some of you may not, that the Ogunquit Police Department has a total of 11 full-time police officers, and the 11 of us are responsible for coverage 24/7, obviously 365. So, well, it makes it difficult to have a huge staff on at once. We are flexible this time, given the situation with our scheduling, and we've adapted to be able to have more people on at once by modifying the schedule and implementing some emergency scheduling measures. Currently, we have 8 community service officers, 1 reserve police officer, and that entire staff was working on the 4th of July and throughout the 4th of July weekend. Normally, on any given day in the summertime, we have 1 CSO stationed on the marginal way. We have 1 CSO at a minimum at the beach, 1 minimum in the square, and we currently have 1 CSO in the town hall, and they are taking temperatures, distributing masks, and they're coordinating socially distanced lines for the different departments within the town hall. So at a minimum, now we have 4 CSOs on during the day. That's how we like to keep them spread out, or that's how we try to keep them spread out. On the weekends, say Friday through Sunday, we have multiple in each location, along with a roving patrol, like a CSO or reserve police officer on a bike. And again, last weekend, the entire CSO summer reserve staff was working. If one of the CSOs encounters an issue for compliance about masks or social distancing or any kind of resistance, they are calling a full-time officer, and we are issuing citations for those violations. So, it's not just a situation where the CSO is asking, and if it doesn't happen, it doesn't happen. They're radioing in, and we're sending out a full-time police officer to intercept the person who aren't particularly cooperative with the CSOs. In the beginning, and as businesses started to reopen, we performed individual opening plans with multiple businesses. We provided suggestions on a one-on-one basis for things like how people can queue up. We purchased and provided pavement marking tape to go along with those suggestions and help them deploy that. And we also provided early on social distancing and please wear masks signage for dozens of businesses. And we did that on as requested. We let businesses know we were doing that, and we took several requests for assistance, and we answered all those on a one-on-one basis. To answer community concerns about the quarantine, early days of the quarantine obviously were much more restrictive in that it was a stay-at-home order even for those within our state, and there were no people were allowed to travel except for emergency purposes. As that has broadened and allowed more people to come in, there are still areas that are not allowed to come in currently without a quarantine or a negative test. Most notably is the state of Massachusetts. We created informational packets that have changed where the governor's executive orders and the rules that have changed. When we were made aware of concern of a potential violation of those orders, we hand deliver the quarantine rules in an information packet to the people who potentially are in violation, and we do an investigation of our own to determine whether or not there is a violation of those rules. I can tell you that there was situations or have been situations when we've sent people back to their home states, or that we made them aware that their activity was potentially a criminal act, given the governor's executive orders. One example of when this process worked particularly well for us was we had a call on, I think it was Friday or Saturday, and the caller was concerned because a house near them was for rent, and a family arrived from Massachusetts and was going out and about, and they were concerned because obviously Massachusetts is still subject to that 14-day quarantine or negative test. So we sent a patrol officer up with a packet, and the officer spoke to that family, and they all produced negative test results within 72 hours. So they had all gotten a test and provided the officer with those test results. So they were following the rules. So it's a situation where we were able to follow up and give some peace of mind to our complainant, as well as to the community members that when a complaint is made or when a concern is arised, that we're responding out there and following up. So that's sort of a situation where everything went the way that it was supposed to go. So I thought it was important to highlight that. Early on in the pandemic, when things closed down, we started the neighbor outreach program and worked very closely with the Ogunquit Rotary Club. They took over calling residents who they have identified as in need or potentially in need, living alone or seniors who might need help. And we ended up matching volunteers in town with, I think it ended up 9 different families or individuals. And the services that those volunteers provided included shopping, picking up medications and mail, and some of those continued to this day. We also, with donations from local restaurants, we ended up delivering hot meals to all those people on Easter and a couple other times when hot meals were dropped off. And that was another great example of the community members coming together and volunteering, and the local restaurants providing food for those people. So couldn't have done it without the Rotary and that community support. When businesses were allowed to start to reopen, we designed and implemented an opening plan for Perkins Cove. And that plan included changing the parking flow down there, using facilities to construct parking signage that we could affix our temporary parking signs to. And we offered one-on-one assistance to several businesses in Perkins Cove, doing those opening business plans that we had discussed earlier. We have ordered and helped install masks, social distancing, beach marginal way, and rule signs in appropriate areas. So the police department coordinated the effort to get those signs, some of them designed, and helped install those and coordinate the install. And just as an aside, some of those signs were removed, taken or defaced in the square area, and we ended up criminally charging one person for that. Thanks to some great witness statements and some information, we were able to criminally charge someone, and that will include restitution for the damage to the signs. Because of, as we discussed in earlier meetings as well, some of the visitor services staff is reduced because a lot of that staff is in an identified area of greater risk, and they've decided, some of them, to sit out this year, understandably. So our staff has assumed most of the ticketing enforcement. So parking tickets that would normally have been handled by visitor services is now being handled by our community service officers and our reserve staff in the paid lots. We're currently in the process right now. We have interviews today for 2 additional community services officers, and we are continuing to advertise for more. So if anyone's interested or knows someone who might be interested, reach out to the police department if you could. We are looking to fill some additional slots. One thing that just came to fruition on Thursday this past week was we installed the town electrician installed the new loudspeaker at the beach, and we got that up and running. That loudspeaker is based, the speaker is on a pole near the awning, and 2 more speakers are going up as well next week. But it is in the lifeguard shack, is where the control module is, and JP went through the manual, and he's been doing some of his own announcements, and I think it sounds great. One of the things that we noticed, because JP made an announcement and checked in with his guards, was that his guards on the marginal way were actually able to hear the announcements. So they're able to capture those on Little Beach, and we're able to capture some audience on the marginal way with that speaker. One of the features of that new speaker, which we're still going through training, and the technical aspect is you can upload messages that you can play on a loop. So our social distancing, our wear a mask messaging, JP's messaging about the beach rules specifically can all be played on a loop at timed intervals, which I think could be a nice feature and might help remind our beachgoers about our rules. All of our staff, so CSOs, police, and visitor services, they have a supply of masks with them. And so they're handing them out to people who are not wearing masks, offering them to any visitors who might not have them. So that's not just a function we're doing on the marginal way. We're doing it at the beach. We're doing it everywhere. There's a staff person that they have a supply of PPE. Really, we purchased fanny packs for all of our staff, so they're carrying a rather large supply of hand sanitizer, masks, and PPE supplies, both for themselves and to distribute. We procured personal protective equipment supplies for our staff, as well as to distribute to town departments and the public. And to date, we have purchased 4,000 surgical masks, 10,000 gallons of hand sanitizer, dozens of cases of disposable gloves, over 100 face shields, and gallons of disinfectant spray. All of those supplies are at visitor services booths, given to each individual department head to distribute and make sure are being used on site. And we also purchased, I think it was 14 no-touch thermometers. So each visitor services booth would have a thermometer inside, as well as every department would have its own thermometer to do our procedure, our daily procedure of temperature checks for all town employees. This past weekend, on Friday and Saturday nights, Sergeant Pollock performed COVID-19 inspections in every restaurant. He went to every restaurant, either on Friday or Saturday night, and our emphasis was on education and assistance. Sergeant Pollock made them aware of guidelines and answered any questions that they might have. He did take note of any potential issues, and he issued corrective directives to them if deficiencies were noted. Most of them were extremely grateful that we were out and doing those checks. And as a direct result of those inspections, he assisted 2 establishments with pavement marking tape and helped them form locations for socially distanced lines. So that's kind of a longer rambling of what we've been doing, but I thought it might be helpful to put everything sort of in one place. And I did write up the summary as well, and if it's helpful, Bob, I can email it to you, just so people could maybe look at it, because sometimes I talk fast.
Okay, thank you, Matt. That was a great synopsis of recent history and the total history so far. Before I ask my question though, I think what you just outlined for us covers a lot of the information and inputs we've been receiving from citizens. There have been quite a few, some to the select board, some to our website, and some to me directly. So I appreciate that, because it does, for instance, restaurants and checking up on them and helping them out. There were some questions about restaurants. So I appreciate that. That's very interesting. I want a specific question, Matt, and it's a point of law, I guess. When you visited those people who were from Massachusetts and who had their test, I'm under the impression, based on what the governor has said, that you can't ask for medical. Well, they can offer the medical evidence if they want to, but they can also provide you with an affidavit that says they have completed that test, and that covers the town from a HIPAA violation. Am I correct on that?
Yes, we didn't ask them to produce test results. They they were ready. So I feel like they took a lot of steps in order to make sure that they were following the rules. And one of those, I think, was to have the test results readily available. And they were happy to show us. And we were happy to see them. But we, you know, if there's an example, Bob, if they had told us that they had negative test results within 72 hours and didn't produce the test results, you know, that would have worked for us as well. I'm not positive on the affidavit. We don't have a form that they sign. I know hotels do have forms that they sign saying that they've followed the rules, had a negative test. The town doesn't. The town, so the police department has been enabled by the governor's orders specifically to enforce her executive orders, her emergency executive orders, and that's it makes violation of those a crime. So if you are violating any of the governor's executive orders that she's published since March, those are Class E crimes according to her orders. So the police department's would be able to push people to produce some sort of proof if it came down to that, whereas hotels are taking that affidavit as per the state. But just like we would investigate any type of criminal activity, we're empowered to mandate proof of compliance. But generally, people have been either they've left or they've said that they're going to quarantine, or in this case, they produced a test for us.
Okay, thank you, Matt. Any questions for Matt specifically? Seeing none, we're going to move then on, Matt. I think you wanted to have Pat go next, right?
Yes, I believe that was the case. Is that right, Pat?
Pat is on mute.
Okay. Hello, everyone. Before beginning, I thought I didn't know if Dr. Fogg has time constraints, and I'd yield my time. So.
Okay, Dr. Fogg. Well, Eric, do you have a time constraint, or do you want to watch us and then get on, or what's your preference?
I have a 5:30, so I got plenty of time.
Okay.
Okay, then you can listen to us for a while. That'd be great. Thank you.
Thanks. To continue the momentum, I was just going to ask Scott Halen, our code officer, to chime in, because part of the purpose of the extended report was we just experienced 4th of July weekend. And so we did have all hands on deck. And so in addition to the police officer going around, we also had Scott doing some check-ins with different establishments. And I thought it was important also for people to know what we're doing on a going forward basis with any concerns that we might be getting. As you heard from Lieutenant Buttrick, certainly we respond to complaints. We would do that as well for the code office, as well as doing our own proactive activities. So Scott, if you wanted to just update the group, and I don't know if everyone has met Scott, but this is our code officer, Scott Halen.
Hi, everybody. Scott Halen, the code officer. So following up to Matt and his staff this weekend, I was out and about 4th of July in the evening around dinner time. And my objective that night was to go out and just from a distance observe what was going on, primarily with the wait lines, staff, and how they interacted in the masks, and asking customers to have those masks on, to and from their tables. I really don't have much to report, other than from what I saw, everything seemed like everybody was trying to do the right thing. I talked with I personally know most of the managers and owners of these establishments. I sign off on all their liquor licenses and all those other licenses annually, so I've gotten to know most of them. So I actually didn't find any violations, so to speak. Maybe a couple of reminders here and there about people in line. So that was about it. I spent a few hours going around, just observing. And then one other thing that I did come upon today, someone reminded me of the Hospitality Maine COVID readiness training program. I did take that sort of a test today, and one of my goals is to get all the business owners to make sure they're all looking at that and hopefully taking that little test there. It's not much of a test, but it certainly gets you thinking and makes you be doing the right thing. So moving forward, I think for my role in this whole thing is more complaint driven. That's kind of how my office works. I just don't have the time, the resources to do much more than that. So for example, today I went out on 2 complaints, COVID related, and I'll just tell you what they were, and they're very minor. One restaurant was visited over the weekend by someone that saw a staff person that had the mask below the nose, which I kind of see out and about quite a bit. And I'm thinking to myself, that's not really helpful. So I went right down, spoke with the owner, the manager, and they will make it a point to make sure their staff is not doing that. You know, I don't know if it fell down because they were speaking or whatnot. The other one was a shop along Shore Road, has a lot of items outside. The people from different groups were unmasked and they were standing within 6 feet of one another. So I made it a point, and the owner certainly agreed that it's probably their responsibility to make sure if there are unmasked people within 6 feet of one another, that even though outdoors, outside the building, they should be reminding those people that. And they were very receptive to that suggestion. So other than that, that's what I'm doing moving forward. I don't know how I end up with the complaints, or they seem to kind of be going in different directions. I talked to Pam last week about a couple, but I'm certainly willing to do the follow-up. Again, like I said, I know probably every business owner in this town personally at this point, so it makes it really easy for me to have those conversations. So I don't know if anybody had any questions or what.
Any questions for Pat or Scott? Terry Ann has her hand up.
Scott, so you only go out if a complaint comes in. So unlike what Matt reported, that they, hit all the establishments from an education perspective. So you don't have a systematic, like, I'm gonna see these 5 businesses on Tuesday and these 5 on Wednesday and these 5 to make the rounds. You only go if there's a complaint.
Generally, yes, only because I simply don't have enough time. I still have my full-time job, and it seems to be very busy here with building and everything else going on. But for like Saturday, for example, yes, that was a outreach type attempt. And ironically, I did show up at a few places right after the police were there, and I was told that they were just there, and that was okay with them. You know, it was just an extra set of eyes. But there's no formal, I don't have any formal schedule, I'll say, that says I'm going to these businesses today or whatnot.
And do you have for your code enforcement, because you are also considered our health officer, so for your code enforcement, do you forget COVID-19, do you do systematic visits, or is that just complaint driven also?
No, annually we inspect all the business establishments, all the premises get inspected for life safety issues, mostly, egress and proper fire extinguishers and suppression systems, that cooking equipment, things like that. So yeah, we definitely do that. That's just routine. Yeah.
Okay, thanks.
Okay, any other questions for Scott or Pat? If not, I don't see any. Pat, is there anything else you want to add?
Sure, if I could, just thank Scott and Matt for their thorough updates. I think part of the reason why I asked Matt to do a complete retrospective of where we've come from since basically March 13th up until today is we did a whole lot of preparation work. And you all know that very well since you were part of that, to get the town through when we went through the close down period and then what we needed to do as we got into the reopening period. And I think that it was all basically to get us to this point where we could have what I think from all accounts, unless you all have heard something different, a very successful 4th of July weekend from a health standpoint. The weather wasn't great, but it also showed that people want to celebrate 4th of July in Ogunquit regardless. So we did have more people than we have been seeing. If it had been even better weather, I think we would see more. I do think as time goes on, people will know and say, I'm going to have my annual vacation in Ogunquit like I always do. And as the governor is opening more opportunities for people to visit us from different states, to be able to stay in our motels and inns, I do think that we will start seeing more people. And so to that end, I think that what we've been doing so far, as Matt and Scott have both explained, is getting our staff trained and in position. But we also need more, which is why we were so pleased that we were able to get the Keep Me Healthy grant to be able to hopefully hire some reinforcements. On that point, I would say that we certainly have put out feelers as well as ads. The applicants are not coming in as fast a pace as I would hope or would like. So to reinforce what Matt said, if anybody knows anybody that really cares about this community, wants to walk out and about on the beach for just a couple of hours a day, they can choose their own hours almost, as well as going around the town just to make sure that they're observing and that if there are real problems that we can be able to help people through with those. That's what we want to be able to do. A couple of other points to highlight. The number one complaint I'm getting, and I think you probably are as well, is that some people do not believe that we are doing enough when it comes to enforce people wearing masks. And I think that there's an education component to that in terms of what is acceptable. And I also think that we also have more work to do as well. But as Matt said, all the CSOs have masks that they are equipped with and are handing out. Our visitor services staff do as well. And I think that that's an important thing for people to know. When people show up at our visitor services booth, after they do their greetings and take their payment, the last thing they say is, do you have a mask? I'm happy to give you a mask if you need a mask. They don't force it on anybody, but they're able to do that, and trying to reinforce that we want people to be wearing masks when they're out and about. I know that one of the comments that we got from Bob and Pam was there was a visitor services person observed at the attendant booth not wearing a mask. I would say at Main Beach, we usually have 2 people there. They're in close quarters and they do need to take a break. So to step aside, be away from other people and remove the mask for that moment. I'm thinking that's what you saw and discussing this with the visitor services folks. And I think it's understandable. As we all know, when you've worn the mask for a long time on a hot day, you need to take a breath. But you do it, out of breath distance with other people. But certainly, so just for the visitor services people are reinforcing the mask message. Our bathroom attendants, we only have bathroom attendants currently at Main Beach. We want to be able to get them at the other bathrooms, especially North Beach and Footbridge. Again, for social distancing, but also to reinforce the mask message as well. Let's see. In terms of some other things that we haven't really touched upon, the town office, we're still trying to keep people, not all the staff on duty all the time, It's harder when we're a week away from the election. And I just wanted to remind everybody about the election in terms of the special precautions that we as a municipality have to take to make sure that people who want to vote absentee are being able to use, as well as people who decide to come into the building on election day. We are emphasizing very strongly that absentee balloting is still available. It will be available up until 8 o'clock on Tuesday, July 14th. We installed a secure lockbox so people can drop off their absentee ballots in person, know that it got into the town office if they don't want to bring it in personally, which we're discouraging, or to even put it in the US mail. So that was something that the town clerk, Chris Murphy, was very committed to doing. It was something that the governor certainly encouraged, and we are able to have the cost of installing that lockbox paid for by the state because of the importance of keeping everybody healthy. Election day itself, we already have the marks on the sidewalk and into the building for just routine visits to the town office. We will have to have more of that as people come into the town office to carry them into the auditorium. The state has provided some PPE, some plexiglass windows and so forth, but we're really relying on ourselves in terms of what we need to do to keep our election workers and our voters safe. So that is a big emphasis for us at this moment in terms of keeping everybody in Ogunquit healthy and safe. Let's see. The bathrooms, as I touched upon earlier, I think that we have not had the lines as we've had in the past. Again, I think it's the combination of not as many people in town. The weather hasn't been with us, but we expect that we will have lines at some point. We will be putting out the tape on the areas leading up to the sidewalks and the doors, but we haven't felt it necessary right now because we have had the attendance at Main Beach. If we don't get the attendance as we would like at North Beach, we certainly will have more tape marks along there as well. And I also just want to say that we continue to work with businesses to the extent that we can be helpful at all. I think the businesses, as reported earlier, have all taken this very, very seriously. They've put an enormous amount of investment, both monetary as well as time, into making sure they can open and maintain being open safely. But as Matt pointed out, we did a lot of proactive outreach to help businesses in any way we could, and certainly we want to continue to do that as well. We've heard from a couple that certainly could use some help with social distancing on particularly busy evenings, but we really unfortunately haven't gotten to the point where there have been those kind of crowds. So that's a mixed blessing, I would say. So if there are, so I just really want to thank everybody for all the work that they have done. When I say everybody, I mean the staff, I mean the COVID-19 task force, everyone in this community who has taken keeping Ogunquit safe so seriously. I think as I hear from other managers and the kind of things that they're up against, I feel so fortunate that we've got people that have really owned this and have taken it as a point of pride in many respects to make sure that we're being very responsible for our own health and for our neighbors' health and for our visitors' health. So we can always do better. We can always do more. I think we're going to be called on to do more in the weeks ahead, and we want to be able to do that. So if there are questions or suggestions, we certainly are open.
Okay, Pam and then Rick, please.
First of all, thank you, Scott, Matt, and Pat for coming and giving us a thorough update. We really appreciate it. I do have one question, because so many of us are getting emails. Bob says he's gotten personal emails. I've gotten personal emails about complaints. We get them on our COVID task force. line. Rick has been handling the bulk of those, and then he triages them to Matt and to Scott. Scott's been getting some, and Matt's been getting some. So we have a whole assortment of us. Maybe not on this call per se, because we don't want to take up the time, but we need to come together with a consensus of general messaging, because I know what Rick's saying, but I don't know what other people are saying. And if it needs to go, if it should be defined that this is something that goes to Matt, it should go to Matt. If it needs to go to Scott. Where my concern lies is that I think I've seen 3 or 4 names that keep coming up to different people, and I'm not sure if they're looking for a different answer along the way. So, which they might be. And so I think maybe if that's a conversation that we can have offline, just to say who answers these questions, who feels them, and who they should go to. I think that would be helpful in the long run. So we have a consistent message and it's education, etc. Thank you.
Thank you, Pam.
Definitely agree.
Rick?
Yeah, Pat, thanks for everything. You know, thanks for all your support through this. A lot of the messages that we've gotten were concerns about all of the compliance and non-compliance, and you've seen what people has been doing. And you're sharing from your perspective, what you see being done. And the thing I want to say about mask wearing is we can push mask wearing as much as we can, and we have to now, as Eric pointed out, the new order, but it's still political. There's a piece of mask wearing that's political for a lot of people, and no matter what we tell them, they are not going to wear that mask. And so we have to, I don't know how we accept that, where we don't have to let them into business, but they're walking around out on the street not wearing a mask. You can only go so far. You know, there's that anti, whatever that is, it's there, it exists, and we have to acknowledge that. And then the other is that, I was going to say what Eric said about the governor now says that in the businesses they have to, what is it? They're mandating people to make people wear the mask. So, which again, now you're mandating it. So now it's going to be, do I really want to? But that's, but that's what I was going to follow up is I have a guest who was here this weekend. She went out on the 4th and she was very concerned. She was concerned about even coming. She came up from Massachusetts. She had her test done. She signed the form. Everything's all legal. But she was concerned on the 4th because there was so much non-compliance. Then she went out again on the 5th. It was a whole different world for her. She felt very comfortable. She actually wrote this nice post on Facebook about come to Ogunquit because it's probably the safest place you'll feel as a tourist. So I thought, you know, once we got through that one day, which is typically a very difficult day for everybody anyhow, I think we need to acknowledge that some of the things that happen on that day are not our normal guests and normal behavior. But I want to let you know that she just thought that it was fantastic. So I was really pleased to hear her say that. And of course, she said we were fantastic too. But that's
She was right.
Thank you, Rick. I actually got some positives too, amazingly enough. And some people stopped me on the street to say thank you for the task force. So that was very nice. I have one question, or not a question, for Pat, Matt, Scott. If you're having issues staffing, and I saw some inputs from citizens seeing the CSOs sometimes dealing with some level of belligerence, do you need anybody from the task force to volunteer and maybe just stand next to a CSO and hand out masks? We kind of sit in this Zoom thing here, and I sometimes feel like, boy, I'd like to get out and help. I don't know if that's appropriate. We have no training, of course. And I just throw that out there that if you needed someone to stand next to a new CSO and just help out and hand out masks and, thank people and et cetera, I would be willing to do that. I don't know. I'm not saying everyone has to be interested in doing that, but if you needed somebody, you could always call on me, and I'm sure some others on the task force would be interested as well. So you're welcome to call on us if you'd like. Now you can tell me that I'm not qualified and that I have to do 40 hours of training, and you can't teach this old dog any new tricks. So you decide what you do, but the offer is out there.
Thanks, Bob. No, I think you're supremely qualified. I think because part of what we're trying to get is people that are not quite CSOs with that level of training, but who are ambassadors, and that, you know, the friendly face, but the important, you know, people that care about each other. So that's the next tier of people that we really are looking for in addition to the CSO. So if there are any people on the task force or others that you know of that want to do that, and again, it wouldn't be it'd be hours that you want to work, you know, it's not a lifetime commitment. It's not an 8-hour day. It's, you know, it's more of a just trying to be helpful in the community and get that face out there. That would be great. So I thank you for saying that. And while I got the floor, I also want to just say that I've gotten incredible positive feedback by the message from the A-frames about welcome back. And that we're a friendly community. We want everyone to be safe, but we're a friendly community. I've gotten incredibly positive feedback about that.
Pam, last thing, because we got to get Eric on here.
Absolutely. Just last one, just as for Pat. Pat, when you've been doing your outreach, I've seen stuff on Facebook or the police blogs. Have you looked at the local colleges? I know not many of them are back yet, but there's a lot of students or high school students that are still kind of floating around without jobs that are over 18 that definitely have the capacity to stand for 8 hours to look into that for CSOs. I don't know if you've looked at that pool, because it's a huge pool and it's all walking around on the beach.
You can't beat that.
So
yeah,
we're in 30 college campus job boards right now. Sergeant Pollock has submitted the jobs to 30 so far. But no, that's a great suggestion. Thank you.
Even if you sent it out to, you know, the Wells High School, they could send it out to their students that have just graduated that have time between now and when and if hopefully they get to college this fall.
Yeah, and we did Wells and York and local high schools looking for teachers too, who we thought might have the summer off and want to do something. So another good idea.
Thank you.
Okay, thank you, Scott, and thank you, Pat. And I know you're busy people, so au revoir.
Thank you. Good job. Keep it up.
Thank you. Okay, Charlie, maybe we should get Eric on here so he can give us the update, and then we'll go back to you to do the CDC update, if any. Is that okay for you?
Yep, that works for me. Very fine.
Okay, Eric, you have the
Good
floor.
afternoon. Yeah, good afternoon, everyone. I kind of freestyle this as I have the last few times. If the information I'm sharing you want more of, less of, whatever, let me know. But as I was listening to your great discussion, I got the alert on my phone about that new executive order. So I sent the Portland Press Herald press release on that. Thought that was interesting and timely with your discussion. So I'll give you some hospital numbers. Our hospital, actually, York Hospital is full today. We're at 100% capacity, but 0 of those patients are COVID related or COVID diagnosis. So just one of those things where we have our capacity ebbs and flows, but today we seem to be really busy. We have not had a positive COVID patient inpatient in quite some time. I don't think since the last time I spoke with you. One thing that is new that I think I shared last Wednesday was the launching of our rapid testing. I would assume, because I worked there the entire 4th of July weekend, that several visitors to the area staying in maybe some of your businesses were able to use our rapid testing site, because a lot of folks indicated they were heading just a bit up the road. So if you have any feedback on that, let me know. But in the past week, rapid testing, we've done about 550 rapid tests. We've had 8 positive results out of that. That's a less than 2% positive rate, which is consistent with what we're hopefully expecting statewide, but they're all from out of town. I think out of those 8, 5 were from Texas and 3 from Massachusetts. To date at York Hospital, we've done 2,435 tests for COVID, and we have 70 positives. So we still remain, again, around 2%. In the last week alone, our percent positive rate is 0.8%, so less than 1%. So again, we continue to look good. But I think it's important to note for this group, the positive cases that we might detect in Maine, either through my testing site or others, always go back to the state of origin. So the 8 I just described to you from Texas and Massachusetts get reported to those home states. So they don't show up in Maine numbers. So, Charlie will give you your state CDC reports. Keep in mind that those are residents of Maine, not visitors. It's an interesting way of reporting, but that's just how the CDC handles it. So we continue to be busy at our drive-through testing sites. I think a few of you folks have reached out to me personally, and I've tried to get you squared away with that. But for those who still have questions or maybe didn't see, I'm going to link in the chat box here a link to our testing options at York Hospital, including our rapid testing and how to go about doing that. So that should help answer those questions. So what can I answer for you folks, or how can I help today?
Charlie, unmute, please.
Okay, Eric, in listening to Dr. Shaw today, he reported that there had been an outbreak, I guess that's what he called it, at Pratt Whitney in North Berwick, which is here just down the road. 6 cases, I guess it was, thus far confirmed. Have you heard anything about that? And can you give me an idea of anything you know about it?
Yeah, I know what you know. We heard this through the state reporting, but not through anybody seeking testing through York Hospital. Sometimes in what the state calls a cluster, sometimes the state will deploy a response there. I'll do some digging around, Charlie, and see if I can gather any more. But that was brought to our attention through the same mechanisms, I think, that you got it. So sometimes we get clued in when folks start showing up at our facilities, but we have not seen a Pratt Whitney request yet. So
a follow-up is, to date in Maine, we've had 110 deaths. And to my knowledge, only one of those has been in York County. Have there been any in Ogunquit or even York in that, in the time of, because I guess the outbreak really started way back in January. I guess January 21st was the first US case that was recorded. And since then, there's been 3 million in the United States. Have you heard of any deaths, like I say, in York or Ogunquit?
So what I can say is, as you know, and this has been something contentious, that the CDC reports county numbers, not town numbers. So what we know based on the reporting is there's been 11 deaths in York County since the start. And of those, 5 of them occurred inpatient at York Hospital. So I don't have town specific data because they don't record it that way or report it that way. I wasn't intimately involved with those deaths in the hospital to know where they may have resided or come from. I assume them to be local, but I know there's 11 in the county since March 1 and 5 at York Hospital.
Okay. Thank you, Eric.
Yeah.
Eric, there is, they do report the number of cases, not by city in Maine now, not just the number of cases, not deaths, but cases. So like Ogunquit has 1 to 5 probable, that's what they're calling that. And the same thing, Wells had I think 24 confirmed, but this does not say how many of them recovered, how many have not recovered, or anything else, which is something that's only been in the last less than 2 weeks.
Yeah, that's a good update because I know there was a lot of pressure to do that. There were a lot of towns that were wanting to know that information. So interestingly, we get a report from the CDC and I'm looking at my CDC report and I'm not getting those numbers. So you have something better than I do.
It's actually on the main CDC website. You'll see it, and it is by state. It is by county and is by, it's actually a map, and you can click onto Ogunquit, click onto Wells, Berwick, whatever, and it will tell you the number of probable and confirmed cases.
Right.
By
Per city.
zip code. They'll do it by zip code.
Excellent.
Yeah. Becky has her hand up.
The state released the number of positive tests that have happened in non-residents from April 9th to June 30th. There were 107 altogether. It started out in April around 18 or 19. And towards the end of June, around 26, 25 cases a week. So it'll be really interesting going forward between more people coming from out of state and more of the testing that you're doing in York County to see how that number does or doesn't go up for non-residents.
Yeah, we're tracking it as well with our own data because we feel like if you tested at our center and are staying in York, Ogunquit, Wells for the next 2 or 3 weeks, that it does impact our community, right? It's not like someone tests and goes back to Texas or Massachusetts that same day. And we do report these numbers. Every positive case, we call the state immediately. It's a reportable disease, irrespective of where they're from. So we do report them. And out of the 5 Texas, 4 were together in one car, which was interesting. So by definition, it's a cluster. And number 2, they had been in Maine for a week prior to testing, staying at a house in Saco. So we elevated that to the field epidemiologist on call. This was on Saturday. So it's really interesting now that I'm interacting more, not only with our community, but also folks coming into our communities and visiting. Certainly I agree with you. It's something to keep an eye on.
Fuzzy.
Yeah, Eric, what are the chances you're doing these testing that you're doing right now next year at this time?
Crystal ball time.
I am hopeful that we're vaccinated and we're medicated and moving beyond this.
There's a vaccination?
I'm hopeful. Did you say next year? At this time next year?
Okay. So one other question. When will you go out in public and go into an indoor setting with no mask on? And when do you feel comfortable? When will all of us, this whole mask thing, we're acting as if we're in like the midtown or midsection of this thing. We're on the first chapter of War and Peace on this thing. So I suspect you'll be running these tests next year at the same time. And you'll probably ramp down a little during non-holiday season. We don't take tourists in the winter. And then as we ramp up to try to make our money, being a tourist state is what we are, you'll have to start doing these tests because a vaccination is hopeful at best. I hope you're right. Treatments, those are all fantastical. In reality, what do you think? Honestly, you're doing these tests next year at this time.
Yeah. So I let me approach it this way. I think what I envision next year is we will have some vaccine available, whether it's effective or not, because we're ramping this up so quickly. This is unprecedented. Even if we get a vaccine to market by January, that's a timeline that's going to give people caution about the effectiveness and the safety of it, right? I mean, the other thing that I don't want people to forget is I believe that we're going to have the ability to do at-home testing for COVID at this time next year. So when you say, am I doing it? I would envision you go to Walmart and you buy a kit of 5 tests for $20 and you can test yourself regularly to figure it's no different than a home pregnancy test, or that's the technology that we're talking about here, that they're going to perfect that so you can know without having to come to a test site the status of your of whether or not you're infected or not. So I would envision greater accessibility to testing, including a possible at-home testing kit. That's what I see. I think that is much more plausible than me heavy lifting what I'm doing right now down here, which is a little clunky. It's a little, it's based on numbers and volumes and all that sort of stuff. So that's how I see it.
So you see, hopefully a vaccination, or we start testing ourselves, but the disease still rampant, the disease still effective. We're talking right now, like we're on the Titanic, and we may be at the back of the boat with the pretty view of the water, but the rest of the country is in the front of the boat going down.
Yeah.
And until we think of this like community as a whole, holistically, where U.S. mask it or casket, whatever, the United States, Canada's going to probably think twice. I mean, we're leading the way and being awesomely dumb here. And and I don't know how that changes, because these nickel and dime arguments, whether you should wear a mask or not, you would say mask is the number one thing to kind of prevent transmission, right? That the best we have. Would you not say?
I would say that wholeheartedly. I know that this is a contentious debate, but in my world, in the medical world, would you want your surgeon not to wear a mask if he's operating on you, right? I mean, it's basic science. The ability to inhibit the transmission of any respiratory thing is decreased by masking. We've known that forever.
Right. So I agree. So in the sense that maybe at some point we should stop thinking about making signs out of paper, but start making wooden signs and start making this like, this is not going to be gone next year. So whether we test at home or like, we'll still be having to wear a mask at the marginal way, even if we can test at home, right?
Yeah. And Buzzy, I think we going forward for the foreseeable future, we're going to have cold, flu, and coronavirus season. It's going to be part of what goes out. Now, does the virus mutate over time and become less contagious, less lethal? We see that with the flu, right? We have horrible flu seasons. We have very light flu seasons. These viruses tend to mutate constantly. I think it will be bundled with a vaccine series that you get in the future, where it's a one shot that covers multiple pathogens going forward. But coronavirus isn't a blip in the radar that goes away. You're absolutely correct. We will get better with treatments. We'll move forward with vaccinations. We'll test better, and our lives are changed forever going forward to some degree or not.
Thank you, my friend.
You're welcome.
Rick, and then Alice, and then we're going to cut it off.
Eric, thank you again for being here. There's a question in the chat that you might want to look at, Eric, to you. Yeah. But also my question, you said you did how many tests this weekend?
So I can tell you, since last Wednesday, I've done 540. So over the weekend, I do about 90 a day of the Abbotts, put it that way.
And how many of those were the rapid tests?
I'm just referring to rapid tests with those.
Okay. Yeah. All right. That's what I was just wondering how that, okay, thanks. So now I'll defer you to the chat.
Yep. So the question is sensitivity and specificity of the Abbott. So for those who don't understand that nomenclature, a sensitivity of a test measures if you have a disease, what's the likelihood that the test will be positive? That's a sensitivity. The specificity of any test is if you don't have a disease, what are the chances that the test will be negative? So this talks about false positives and false negatives. The Abbott rapid test, the thing that was questioned early on was its sensitivity, meaning there was a degree a little bit higher in terms of the false negative rate, meaning you could have the disease and still test negative. That was one of the early criticisms. So the sensitivity was a bit lower than the traditional swab that you send off to a lab. I will tell you that the Abbott test and the instrument has been used all across the country. They have hundreds of thousands of data points on this, and the sensitivity, although a little bit lower than a PCR test or one that you send off to a lab with a result in a few days, it is still a reliable test, meaning it lives somewhere in the low 90 percentile. So it's a good test. It's not a perfect test. As it relates to a false positive, those are very rare. So in other words, the specificity of the test is very good. In other words, if it's positive, you're very likely to have COVID. If it's negative, there's a maybe 5 to 7% chance that you still have it, but you tested negative. Does that help answer that question? So sensitivity, specificity. So this test has a slightly lower sensitivity, but the specificity is in the high 90s, is good.
Okay, last comment comes from Alice.
Okay, so 2 quick questions, Eric, and thank you for being here, for being such a great resource for our community. As you know, because she got in touch with you, we had a short-term rental manager who called the chamber yesterday and said, if somebody tests positive after they've flown here, what is she supposed to do with them? So I was like, I honestly don't know the answer to that. Give Eric a call. And she was kind enough to give us the answer that you had given her, which was basically there is no quarantining facility in Maine. So if we have, and again, we want to give good advice to our member businesses. If somebody runs across a situation like that, I know that you obviously couldn't tell that group from Texas that they can't go stay somewhere, that all you can do is report them. If they get it, if there's a very responsible party, they land at Logan, they fly to York, they get a test, and then they call the rental manager and said, I just tested positive. What's the advice she's to give them? Go back to Logan and get on a plane? Or, for drive markets, we've been saying, tell them to go home and recuperate at home.
Yeah.
But no, I had no idea. And if you want to punt that to DECD, I'll address that to DECD. But since I had you, I didn't know if you had any further thoughts on that.
Well, I will tell you that the folks who did test positive called me. You can do one of 2 things at my rapid testing place. I'm going to get your result in 15, 20 minutes. A lot of people pull over and we queue them up in the parking lot and we run their results out. There's a percentage of people that just want to get on the road, and we have a secure email that we can send you via a HIPAA compliant type thing. And the people that tested positive were all emails, but I didn't just want to email them. I don't know when someone's going to check their, so I called them up. And the conversation got very interesting, as you just described, like, oh boy, what I'm going to wherever, right? And 2 things that advice I can give you. Number 1, I brought your question to Adam Hartwig in our York County Maine CDC field person, and he confirmed that we don't. And he actually thought it was a great question as well. And it went to the FEMA, York County FEMA meeting this morning as well. So I brought it to a bunch of folks' attention. So maybe they'll mobilize something, because it's a fair question. It's not if it's going to happen, it's when it's going to happen, right? Yeah. And so the other thing is I can answer basic questions for folks about, and we provide people with a handout, what to do if positive. Now, that means medically what to do, not what to do if you're checked into a place or have a reservation. But also, the idea is that the state, once we contact the state, calls them immediately and starts the contact tracing part of that job. And that will include, where are you going? Who are you staying with? How did you travel? And I think there's an opportunity perhaps to get some guidance on what they should do from the state, who's ultimately responsible now for this positive test. So that would be my answer, Alice. And then maybe I wouldn't say punt it, but I would get a little bit more feedback too from some of your other resources as well, because I think it's a fair question.
Yeah, we were surprised. It was the first time we've gotten that question in like 3.5 months. So Tori was like, what do I do with this? I'm like, something to ask. Second question quickly, we have been promoting the rapid testing site, and we have a link to your frequently asked questions page on the COVID page on our website. I got the press release from your marketing department today about doing the tests over the weekend and all that. Do you have the capacity that we can elevate that and put it on our homepage, or would you rather have us keep it just on the COVID-19 page? I don't want to overwhelm you guys.
At this point, I've seen people grab it on Facebook and slap it on businesses and all that. So I think adding it to yours doesn't necessarily make it. I mean, it's out there. So I'm fine with it. I just
want to amplify it if you were going to go, oh, we need a couple more weeks to get to that point. Okay.
The state, that press release that you just referenced, the state's going to launch that today. So,
okay.
Yeah. So I think it's fair game.
Okay. Awesome. Thank you.
You bet, guys. You bet. So everyone else knows how to reach me. If you don't, certainly Bob, I know you do as well. Matt reached out to me this weekend, so feel free to reach out. I do my best to respond quickly and help you guys out. I'm here to support and glad to be invited back on the couch, as you say, Bob, every week.
Thank you, Eric. We appreciate it. It's very helpful for the task force and for our community. And I think people who are listening in also appreciate it. So have a nice evening and stay healthy.
Thank you so much, guys. Have a great night.
Thank you.
Thanks, Eric.
Okay, we're going to move along then. Charlie, is there anything further you want to? We're kind of running behind here a little bit, but anything further that you want to bring up?
Not really. I mean, if anybody watched Dr. Shaw today, you know, we added one death yesterday, but none today. And we have 22 in the hospital, 8 in the ICU, and 4 on ventilators. So 110 deaths at this point. 2,856 have recovered. There was that Pratt Whitney thing that I brought up with Eric, so I don't need to bring that up again. I did bring up the fact that the first known case in the US was on the 21st of January. And since then, there's been a little over 3 million cases. And here in Maine, we're at about 2%. And in the last week, 7 days, it was 1.28% is our positivity rate. And cumulatively, it's 3.58%. So anyway, that's all I need to say. I think other people can get this on the CDC website if they need it. So I'll be glad to cede the rest of my time that I don't have any left of.
Thank you, Charlie. Thank you. Just a quick note. I was in the vaccine business at one time in my life, long ago. There are 21 trials with humans in those trials at this moment. That's probably the largest number of vaccine trials at one time with the largest number of companies at the same time for any disease that I can remember. So we'll see how it goes. The platforms for vaccine management have been around for a long time, and so many of them have been effective, and that's the way in which the protein is delivered. And so I think that's what helps us catch up here a little bit in time. But we're not here to talk about medical stuff because we let Eric do that, which is good. Rick, you had some comments on what you've been seeing. Any further comments, Rick?
I mean, on the messaging that we've gotten?
Yeah.
There were a few emails that we got over the weekend, and some went to the select board. Some, like Pam was saying, came from all different places, but they all finally merged into one place. And they were specific about where there were some problems and some issues around non-compliance, including the marginal way, including around the bathrooms and the snack bars and things like that. So I think listening to what Pat had to say, what Matt had to say is, you know, as we now have the money and have the extra enforcement possible, I think that's probably the best option that we have, is to get more enforcement out there. And I think, Bob, you said you're going to go out there and take care of people as well, so that's great. But most of the emails are just that, or they're still asking the same question: what are the limitations? When can I come? But if there's any specific concerns about a specific restaurant or shop or whatever, I'm forwarding that to Matt and to Scott so that they can follow up appropriately and educate. And then as far as the mask wearing, and there's a chat question about fines, and Matt was actually he answered it on the chat. They are going to start issuing some fines. So it's which will probably, you know, that might, if we have the CSOs to do the coverage, you know, down at the beach, down by the bathroom and stuff. But that's kind of where it seems like that's where where the crowds are, where there's a little lack of organization. I think up in town, a little more organized, but down by the beach, there's always that mishmash of people walking all which ways. So, but I no unusual messages other than detailed.
Okay, thank you, Rick. Appreciate that. Any questions for Rick? Rick's doing a great job. I think maybe Rick, you, Pam, and me can talk about how we can kind of consolidate this in a more effective way over the next couple of days, because I think that's a good point. All right, we're going to move into the subgroups. Kent and Rebecca, Becky. I said I was going to call you Becky every time tonight, and I've already failed. Becky and Kent are data. But I don't know
So
other.
no new data from me this week, Bob. I am working with the visitor services to get some parking lot data, just to look at year-over-year trends to see how far below last year numbers we're trailing and what we might expect going forward if the conditions remain the same. So we're working on that and still trying to derive the same for general volume around town trends versus last year. So hopefully we'll have more to follow on that in a while. Becky, you had some, Pam?
Ken, I had a quick question about the parking lots. The last 2 weeks in June when they opened, what percentage were they compared to last year? For the month of June?
Yeah, Pam, I asked for that data and I should have it in the next couple days.
If you have some problems, I may be able to supplement some of that for you. Okay.
Yeah, I'm waiting on the full month of June and July to date, and I should have those hopefully tonight or tomorrow, and I can do those comparisons. But Ray did tell me that July this year, month to date, July is significantly lower than last year, largely driven by weather.
And June was significantly lower than it was last year too, by quite a bit.
Yeah, I just want to look at those percent variances to see if it's weather related, if it's COVID related, a combination of both plus other drivers, just to see if we can figure out any trends going forward. So.
Thank you.
Yep.
Becky, further comment?
I only had that comment about the number of positive tests in non-residents.
Thank you. Terry Ann, you and Buzzy have the floor.
Buzzy took the floor, and I'm glad for the questions that he raised with the doc, because that's what we need to be thinking about. I'm only going to give you marginal way data from the observers for this past week, 4th of July week. The total numbers for the 5 days were down about 47%. And on the weekend, 4th of July weekend, the numbers compared to 2019, down about 40%. The observers reported that compliance on marginal way for mask wearing over the week took a big jump from basically 50 to 70%. 50 to range was 50 to 65 to 82 people, and the average percent, not people, but percent. The average percent was 74% compliance. There was a complaint that came in through our email from a resident who was very concerned about a large group of folks coming on to Marginal Way on Saturday, none of whom had masks on. It's a group of about 20 to 25 that ended up down on Mother's Beach, all sitting together. But other than that group, the usage seems to have jumped significantly.
Carrie Ann, where's Mother's Beach?
It's along Marginal Way.
You mean Little Beach?
Well, I call it Little Beach, but other people, I think, call it Mother's Beach.
Because Mother's Beach is in Kennebunk. That's why I was confused.
Oh, no, I know there's a Mother's Beach in Kennebunk.
Yeah, that's it. Okay.
Just for the other side of the public health is that I think we're still approaching this with this attitude that this is seasonal. And I just think, Kent, I don't think the playoffs opens next year. I mean, I think there's so many things that we are so unaware of, and I think we should take any of this grant money we're getting, which we should be moving to more of a multi-year idea of how to wear masks and make these signs wooden, or get back to, because all the waste of paper and all these things, it also doesn't show any like commitment to this, to what we're doing. It shows like in the moment, kind of do this, but whatever, in a couple of weeks, we'll figure it out, or we'll open more, or, I mean, it's frightening what Eric just told us, that he's hoping a vaccine comes out with no solid idea. I mean, Bob, you even scary enough. You said You got 21 people thinking it's not in trials. Those are, even if those work, or even if they all pass, they still have to get to market. That's so far down the road. And even Eric said they might not even work if we put them out there. And so the best he said was might be able to test from home. And a test from home only lets you be aware of your current situation. It doesn't go on from as soon as you walk out the door after that test, then you're out to exposure again. So we'll be wearing masks no matter what until we get this thing down to zero, which is not going to happen. So masks going to be part of our lives for the next 10 years. I don't think that's a question. I think anyone thinks that it's not is kind of a little delusional. I think we're going to start grabbing reality really hard.
Buzzy, I want to clarify. Please listen carefully. There are 21 trials.
Right?
21 trials, not
trials.
21 people. The 21
No,
people.
21 trials. No, I understand, but still, those.
We won't be wearing masks 5 or 10 years from now, and I'm not delusional. So.
Bob, is this the only COVID that is out there? So this is the COVID-19, right? So there'll be no other viruses that are spread through respiratory? Or there could be other. There could be other.
We're not a medical body, but most common colds come from a coronavirus. So.
Exactly. So they're going to keep coming.
That this will happen to be.
So again, you have there's no vaccine, right? Bob, is there a vaccine?
Of course, there's not a vaccine because you would already know about that.
If it doesn't happen, then what are we doing? Are we prepared for it not happening? Are we ready for it not to be happening? Or are we just assuming it's going to happen? I think we should be assuming it's not going to happen and working and dealing with what happens if it all of a sudden comes off. If all of a sudden miraculously we have it, then that'd be great. But let's not plan as if, next year it's going to be right back to it. No, we're going to be wearing masks for a couple of years until we get this thing under control. And then going forward, this is the new reality. Maybe we don't. Maybe they find all the cures, all medical, all human science. We can figure everything out. I don't see that being the case, but that's just my opinion. Okay. And I think that now, as a public health thing, Robert, let me finish, and then you can talk. Okay. All right. So just as a public health thing, I would like to see us start extending this idea a little longer than just seasonal or weekly, because I'm very scared schools aren't coming back. I don't know about schools. Stanford University just canceled 11 varsity programs. These are big deals. These are major institutions. Harvard on off-campus learning. These are major institutions making major decisions, and we're still thinking, as long as we get the mask rate or we find a couple people get masked, then we're going to be okay. Again, we need to do more. We need to be thinking bigger, not micro. There you go, Rob. Nice to see. I yield my time.
Okay, let's go to at-risk, Charlie and Pam.
But Joan, I'm sorry, Joan just clarified that Mother's Beach.
I saw that. It's right next to the lighthouse. I see that in the chat. Yeah, thank you.
Yep.
Okay. I never knew it was called that, though I lived 1/10 of a mile from there. As far as the at-risk, I think, as I had said at our previous meeting, we're all at risk. There are 3 known ways to prevent getting COVID virus at this time, well, maybe 4, to stay at home and never go out, but to wear a mask, social distance, and wash your hands. I think our biggest challenge is not only getting people to wear masks, but to getting them to wear them properly. I'm sure you have all seen people who wear masks do not wear masks covering their nose or covering from their nose to the bottom of their chin. You'll see with the mask down below the nose or above. I think some education on that. The one thing that I think in terms of at risk, I think we have a lot of signs out there, but most of the signs, I love the chamber signs, but I wish they had put mask first as opposed to hand washing, because as you're walking, you're not going to wash your hands, but you will see the sign to put the mask on. So if you have to reprint them, Alice, I would suggest you put the mask first and then social distancing and hand washing, just so that it sticks in people's head. They see that. I think that the Chamber's done an excellent job with education. I think the Matt's department and everybody, when they talk with people, are still doing that. I don't think you can never have enough education for the at-risk population. And again, I'll say it again, it is all of us. It is not just, the over 60 or people with immune compromised diseases of any kind, it's everybody. So we're all in this together. I disagree with Buzzy. We will have a vaccine sometime, probably next year. How much they'll produce and when that will be, there are, as Bob said, 21 companies that are in trials right now, and those are human trials. Those are not monkey trials. So I think that's very positive. We have every year we do new vaccines for flu. Every year it's different. It's sometimes it works, sometimes it doesn't, because viruses do mutate. So we will always have to be careful in terms of respiratory. We always should be. So with that, I will yield my time.
Okay, business. Alice, Rick, and Buzzy.
Okay, the committee has not been that active. We've kind of been monitoring the businesses that are open and kind of like, again, I don't need to reiterate, that Matt and Pat and Scott did a really good job, I think, of encapsulating kind of like what we also saw this weekend as we were walking around on Friday, Saturday, and Sunday. We did get, so we put the signs out on Thursday. And again, thank you to the Playhouse for lending the sandwich board signs. The chamber designed and created the signs, and that was supported by the municipal town grant. So we were happy to be able to do that. We put the signs out Thursday in 8 spots that Matt had suggested. And then Friday morning, we got a call from someone who's really passionate and did a great job about pointing out some of the deficiencies at the main beach. Especially near the bathrooms and the takeout stands that are there. So we produced a bunch more signs. Originally, Matt had thought the best place would be in front of the bathroom doors. But the gentleman who called us talked about all the congestion going back and forth from the bathroom and to the 2 snack bars that are there. So we moved the sandwich board sign over to between the snack bars on that side. So the people that were crossing the 30-minute parking area would see the signage. And then we just produced a bunch of laminated signs that we hung all, if you went out of the bathhouse, you'll see them. They're on every conceivable door at the bathhouse that a human being could walk through. So we appreciate that, person giving us a call. They probably just said, hey, who did the signs? And somebody said, oh, it was the chamber. And so, of course, we got the phone call when generally I think it probably would have gone to the PD. So, but it enabled us to shuffle in time for the weekend. So we appreciate that. And Matt, anything you hear about that, if you guys get any ideas and you want to move the signs around, feel free. They're here for the community. So that doesn't have to be the chamber moving the signs if you guys see a better spot to put them in. And that's really about all that I'll have to add. I did, we added everybody on the task force to our COVID-19 newsletter. So hopefully you got that both on Friday and on Monday. And that's just to kind of keep you guys up to speed on how much we're hearing and disseminating so that you're getting an idea of what the business community is hearing from us. And also, we've also been getting positive posts either through email, through our website, and on Ogunquit Now from people who have been very complimentary about mask usage and respectful behavior. So, we've had a few outliers, of course, but we have also, just as Pat alluded, we've been receiving some very positive and grateful, thank you, Ogunquit, for being safe sort of messaging. So, I think we just need to keep trying to do our best and need to keep trying to educate and help the community realize we're all in this together.
And Alice, you want to talk about your mask contest?
Oh yeah, we're still developing that, but this actually came to us from Tina at B3 Born Bread and Breakfast. And she emailed me on Monday and said, hey, a group of us innkeepers were talking over the weekend. We thought it'd be really cool to do a mask contest. And so I emailed her back and said, did you guys have any specifics? And she didn't. We're in the process now of creating some kind of a very positive, fun, and uplifting contest that will encourage people to wear masks around Ogunquit in terms of keeping everybody safe. So Rick is helping us out with some graphics, I understand. So, but anyway, we'll have more details on that in the next few days.
Okay, anybody else on your committee want to take some time? Nope, okay. All right, Matt, let's open it up for anyone who has their hand raised. I know you're responding to the chats. I think the chats, leaving them open throughout the meeting is probably better because I noticed some of you have been addressing those chats, and I appreciate that. That way we don't forget the ones that come early. And so I think that's the best way to do the chats. And I think we're caught up on chats pretty much. Anyone with their hand up, Matt?
Not at the moment, Bob. Now there is, so sorry about that. Michael Stambati. Michael, you should be allowed to talk.
Hey, thank you so much. And I just wanted to echo Buzzy's sentiments. I also was in the medical field and worked for a vaccine company. And what I can tell you without a doubt, whatever vaccine we come up with will not be 100% effective. This is not a short-term flip of the switch. Everything's going to be great in December or January when we get a vaccine. This will indeed be a way of life that will be changed for at least a little while. So as you look at all the great things you're doing, I agree that when looking at different solutions and ways that we can continue to advance and change people's behavior, that we look for it not to be just a short-term fix to get us through the season. We all definitely want to think positive and we want to do the very best we can, but why have to recreate the wheel in January, February, March, because we did something that we thought would be short-term. Best case, hey, it goes great and we get a vaccine that's 95% effective and we have an antibiotic that's actually going to work, because this is a lethal disease. People are dying. So yes, we could have an antibiotic that works and we could have a vaccine that's 95% effective. If that happens, we should be playing the numbers in Vegas. But it's good to try to look at this as a solution that is going to be more longer term and still think positive. I know it's a tightrope to walk, but I just want to echo those sentiments. And just real quickly, I have been talking with some of the CSOs. They are doing an incredible job on the marginal way. I know that Terry Ann shared that the compliance is up around 70–80%. Because I live close to there, I've heard them talking to people and giving out masks, and they've really been doing a nice job of engaging people and getting them to put on the masks. So kudos to them, the training they're getting and hiring the right people to do a good job. Thank you.
And anybody else?
No, nope, no one else.
Okay, any motions for recommendations to the select board? Seeing none. Anybody want to decide when we have another meeting? I don't think the select board is meeting on election day. So we could possibly meet after that on Wednesday. It's up. I put that out there for discussion.
2 weeks.
Pam and then Becky.
I would like us to take at least a 2-week hiatus. We have election, and then, not till then the week after that, we'll be into way beyond the middle of the summer, and we'll have a better idea of what's going on, what systems that are in place now have continued to work, and how Matt and the code enforcement officer and the town are continued to look at the one-on situations where they have to go out and take care of things. We've all addressed the same things. The bottlenecks are at the beginning of the beach, walking down the ramps to the beach. That drop-off area seems to be a bottleneck. In the parking lot seems to be a bottleneck. But with more CSOs and more of them on the beach, 2 weeks from now, 3 weeks from now, we may not have that problem anymore, because the marginal way seems to be improving.
Okay, Becky and then Terry Ann.
My suggestion was 2 weeks as well.
Okay, we have 2 for 2 weeks. Terry Ann.
I just wanted to say one other thing about face coverings and the percentages and compliance going up. I have noticed, I walk every day from where I live over to the beach and then walk the beach. There's a lot of trash, temporary masks on the ground. So I think it's one of the unintended consequences, but I think we ought to make sure, I'm sure the town knows, but I'm not going to pick up that kind of trash right now. So I think we should be aware that there are some unintended consequences of upping mask usage. I'm glad it's up, and I go along with 2 weeks.
Okay, so anyone want to make a motion that we meet in 2 weeks from this day?
Let's see, that's today's date.
22nd.
22nd.
I make a motion that our next meeting is on July the 22nd.
Okay, and second?
Second.
Kent seconds it. All those in favor, raise your hand. All those opposed? You can meet next week. No, kidding. So that is the meeting date for our next meeting will be the 22nd. Any further comments or business that anyone wants to bring up? It's not on the agenda, but Buzzy.
Yes. Just on a personal note, I sold Black Sushi to a former chef. He's taking it over. He plans on opening it. Congratulations to William. He's a local guy. He's going to take it and run with it. And best of luck, Rick. You got a new neighbor just down the hill to the left. And but that's it. So I'm still on the business committee. If you'll still have me, now I'm just going to come at this with a vast amount of wealth that I didn't have before I sold the business. Just kidding.
Okay, so Buzzy's rich. Call him if you need money. That's what I'm hearing. Okay, congratulations, Buzzy. Any other comments, concerns? If not, I'll entertain a motion to adjourn. Charlie, you put your hand up first. You have moved to adjourn. Rick and Buzzy are the seconds. All those in favor, raise your hand. All those opposed, there are none. It's unanimous. Have a safe and healthy week, 2 weeks, and we will see you in 2 weeks. Maybe Rick, Pam, and I can figure out how to collate all the stuff that comes in each and every day. So peace and health. Thank you. Bye-bye.
Thanks, everybody.